On positive disruption, I'm just wondering your personal outlook on those healthcare innovations and positive disruptions. How have priorities changed when you look at the need for disruptions or innovations or startups from your kind of 360-degree view?
I mean, I think that I think a lot of the problems with the healthcare system, with the fee for service system being as you hear a lot of people talk about like a sick care system, have been there for
Yep.
so many years. The incentives are such that it's so much easier for the way the system is designed to actually profit or make money from basically, reacting or being a reactive system to when patients are ill or paying for acute care or surgeries. And it's our system isn't designed to take advantage of people doing population management
Right.
and really providing preventative health care, which is really going to change how healthy your population is. It's going to change the amount of healthcare dollars. It's going to improve outcomes, right? And it's a
Yep.
different mentality. And I keep talking about KP, even though I left. It's just an amazing organization, and like being an accountable healthcare organization that's integrated. Intermountain Health is another example, and there's many other integrated systems that are really taking on the population health mission. And I think that needs to be where healthcare goes. And my thesis is that using a tool, right? It's like not people say, oh, telehealth, you can't change medicine. It's like, no, but it's a tool in your toolkit. It's like, here, I'm going to pick up a hammer, a screwdriver. It's a tool that can help the clinicians out there extend their capabilities and bridge some of the gaps and solve some of the problems some of the things that are really broken about the healthcare system, and maybe, use your resources in a more wise way to try to get to some of those outcomes. I think my
Right.
view of my holistic view of innovation is that the pandemic these things always existed. And then the pandemic forced people to think a little differently, and they had to, right? So I don't think it's a revolution. I think it's an evolution, and the
Right.
evolution sped up for this time period and forced people to do what was already out there. There was a ton of people doing, like did a bunch of telehealth work at KP as well, and it just never
Right.
quite took off. And I remember, people would say, oh, well, hey, you're using it in your integrated healthcare model and HMO, you're not billing for your telehealth. How is that? That doesn't work for me. It's like, well, we're doing the right thing. We're we're providing you
Right.
specialty care
Right.
services in 3 seconds on demand in your ER. I'm helping you resuscitate an incredibly sick kid, and you don't have that skill set. And if we do it
Yeah.
right, you might be able to keep that kid actually in the community instead of driving 100 miles to me over here in Silicon Valley or something. And it's like, well, how do you pay for that? And it's like, part of me was always like, who cares? You're doing the right.
Right. Right.
But,
Right.
I
We don't
mean,
pay for something else. Yeah.
yeah, I mean,
Because
right. And the business reality is like the way the
mm,
market was structured is like it forced you to make these weird decisions to
yep.
not do the right thing, or not leverage technology in the right way, because your payer system didn't recognize doing the work that way. But that's not, and COVID like changed that. Right now, telehealth has become ubiquitous, and I don't think it makes any sense to go back. And I think people, once they're realizing that, they're like, oh yeah, this makes